For the past several years, the intersection of Mass Ave and Melnia Cass Boulevard has been the city's most graphic picture of the opioid crisis. According to the Whittier Street Health Center in Roxbury, some of the area's homeless drug users are also being infected with HIV. To talk about the findings and what needs to be done are the health center's Director of Infectious Diseases and Special Populations, Dr. Cyril Ubiem, and its Program Coordinator for Project Me, Shawn Matthews. Thank you both very much for being with us.
Thank you, sir.
Thank you.
Also, Shawn Matthews, you've been in charge of the outreach at that intersection for a number of years now. What have you seen over the past 6 years or so?
6 years ago, when we started doing outreach on the mile, what they call methadone mile now, there was a few homeless shelters. So mainly you seen was the homeless population wandering around. You seen people, homeless individuals going into BMC and healthcare for the homeless. A little drug activity, but nothing like what it is today.
When you say nothing like what it is today, what's different about what's there today?
You know, it's a large group of individuals that are suffering from mental illness, substance use disorder, chronic homelessness. They're all hanging in one secluded area.
Dr. Ubiem, it's not new that HIV can be spared by use of contaminated drug needles, but you know, given the number of cases, you know, how many are we talking about, and do you see a trend up or down?
We definitely see a trend up and now. We're talking about, like Shawn was just saying, we've been doing outreach there for the past couple of years, but we haven't seen this number of new HIV diagnoses that we're seeing right now. And what it's also saying is that, you know, there's a lot more number of people that you see around the Mass Ave area and Melnia Cass on a daily basis, you know. And in the winter time, those numbers tend to go down. But even this past period, you know, we've seen the numbers even higher than what it used to be. And it's most likely that as the weather gets better now, you're going to see more and more people in that area, in that, you know, location.
Shawn, what happens when you determine that somebody is HIV positive? I mean, do you get help for them? What happens?
So our prevention team, we have a mobile van, and we do HIV counseling testing in that target area. We have HIV testers on the van, and we have the outreach team in the area. They're out there navigating clients into the van to get tested. If a client comes up positive on the van, we have transportation right there to get the client back to Whittier Street Health Center.
Now, I imagine with somebody who has HIV, doctor, that you've got a lot of follow-up that's needed if you're going to treat it properly. That must be pretty difficult to do with a population like this.
It is difficult, but I mean, luckily for us, we have services, you know, that covers the whole continuum of HIV. So we're talking about from diagnosis all the way to treatment. So luckily for us, we are funded by the city, by the Boston City, the Ryan White program. So we have medical case managers, we have peer support services, you know. So we can do we can do rapid testing in the van, blood testing in the van for both HIV and Hep C and also STI. When somebody tests positive, we're going to refer that, you know, we're going to bring that person physically into the clinic and then link them into treatment immediately, as well as also linking them into, you know, the Ryan White program, so medical case managers. So with the help of the medical case managers and in coordination with the outreach team, we can basically follow up a patient continuously. So even if we lose them, we know where to find them. So the case managers working hand in hand with the prevention team can actually track patients all the time and make sure they stay in treatment at all times.
Shawn, another part of your job is you got to make sure the other drug users don't get infected. How do you do that?
Educating. There's never enough education. So our outreach team, when we're out there, we're passing out risk reduction materials, and we're educating them on how to stay HIV negative. So that's part of their jobs.
Doctor, I'm sure this is not the first time we've had a kind of a hot spot like this. What have we learned from other cities about what works to at least cut down the infection rate?
So what we've learned from other cities is bringing services to those populations right where they are. You know, if you know these people, they are busy getting high, 24 hours a day, hustling to get some money, getting some money and also getting high at the same time. So if you're waiting for them to come to the clinic, to the hospitals, they're not going to do that. They're basically intoxicated or high or overdosing. So that's why we bring the mobile van to those places, to them where they are located, and then identify those they need, and then navigate them back into the clinic. We don't just navigate people into our own clinic. There's a lot of people that maybe sometimes they need to go to detox, So we help them to make that happen. Whatever services that we don't offer at Whittier Street Health Center, we navigate those people back. We refer them to those places.
Shawn, you've been involved in this for a number of years, going to that intersection. I'm sure you know the feeling of coming back the next day and seeing the same problems repeat over and over again. Does anything give you hope that somehow your intervention is helping people break that cycle?
When you work out there for a long period of time and working with a client for a long period of time, and that client finally reaches its bottom and is ready to come back, and we link him into care, and to watch that client, go through care, go through treatment, go through detox, and see him on his feet again, it's worth a while.
Yeah. One thing they've said sometimes, sometimes they see some people, it takes 2 or 3 times.
Oh yeah.
To actually convince them to get the services. So you might see them, talk to them today, and then they'll say, no, they're not ready.
Doctor, there's also a wider population worried about this. It could be people in the neighborhood or people who have children going to school right near the boulevard. They're worried about needles. I mean, this is a concern for them too, I think, isn't it?
It's a concern for them, absolutely, yeah. I mean, if you walk around that area, you will see, sometimes you see needles on the streets, and like I was just, if this is in a hospital and someone gets poked by a needle, that's a whole procedure. You have to go through post-exposure prophylaxis, treatment. Just eliminates, the fact that, that needle could contain HIV, could contain Hep C, and all those kind of stuff. So we're trying to make sure that, I mean, definitely, yeah, someone can get, some kind of, disease from those needles on the street by someone, stepping on those needles.
Finally, we should mention that if people have any questions or if they need to seek help in some way, is there a way they can get in touch with the health center?
Yes. So our website is Whittier Street Health Center, which is whc.org. You can also reach us by phone. By phone, the phone number is 617-427-1000. And then there's an operator that will definitely direct you to whatever services that you need.
Thank you both very much, Dr. Cyril Ubiem and Shawn Matthews.
Thank you.
Thank you, sir.
From the Whittier Street Health Center. Still to come, how the arts help the economy and the community. We'll hear about a new report from Arts Boston.